Hi, my name's Alexis, and the purpose of this video is to go over the totality of a diaper change here at Abundant Life. The totality meaning not just how to change a diaper, but how to document, how to communicate with parents that more supplies are needed for their child, etc. So, starting off, we will change the child's diaper with my little child right here. We have the KDHE guidelines for diaper changing posted by all changing tables, as well as the KDHE guidelines just added with Abundant Life's policies. So one of those being glove wearing. We ask that all of our staff wear gloves while changing diapers as a preventative for illnesses and just keeping their hands extra clean. So you will put your gloves on, make sure you have all of your supplies, diapers, wipes, diaper rash cream if needed. You will put a paper towel underneath the child's bottom. And again, this is just another layer of protection from illnesses passing to other kiddos as such. We also have the checks pads. If a child were to have a blowout or really big bowel movement mess, we do have these, which cover more surface area and to keep as much clean as possible. So with that being said, we have our child right here on the changing table. We start by unfastening the child's diaper, and if a child has had a bowel movement, when you remove the diaper, you will try to wipe off as much excess BM as possible. And get your wipes, and then wipe the child clean. You will wipe a child regardless of if they've just had if their diaper's filled with urine or if it's bowel movement. We want to make sure they get wiped regardless. Urine left on a child can just cause unnecessary irritation, and we want to make sure they are clean of that and having minimal diaper rashes. So when wiping a child, you will wipe from front to back, specifically on girls. You want to make sure you get in between all of the creases and crevices that girls have, so they don't end up with a yeast infection or any other UTIs, things like that. While boys can get UTIs as well and yeast infections, it's a little bit easier for girls too. So we want to make sure that we get all the spots in between, make sure their bottoms are clean, and then you'll get the wipe and roll it up in the dirty diaper and set it to the side. Then get the clean diaper and put it underneath the child's bottom. This would be the point where if a child needs diaper rash cream, you would get that out and apply it with the glove, making sure, again, you get in all of the crevices, creases, any spots that could be red underneath on boys, underneath their penis. That would be a spot where that would be super red at times, as well as all of the area on the girls. So that is when you put that on. And then you put the diaper on, fasten it, and get the paper towel out from underneath the child and get the dirty diaper as well as the paper towel, and use your gloves to pull over. And this just helps with smell control. After having 9 dirty diapers in a day, our trashes can get a little smelly. If it's causing the classroom to smell up, we ask that staff members do take it out just for smell control. No one likes to walk into a room that smells like dirty diapers. So after that, you will take your kiddo and go wash hands thoroughly so we make sure they don't pass germs to other kiddos. So after you wash the kiddos' hands, you let them go play, do their thing, and then come and disinfect each diaper changing area. So you will get your bleach water from one of our locked cabinets, whether it's above the sink or underneath the sink. Above the sink, it's out of reach of kiddos. If it's underneath the sink, we need to make sure that it has a child safety lock on it. You put this back in its locked cabinet. And then you will wipe down the changing pad, and you wipe down the changing pad after every single diaper change, and you make sure that you get around the area as well, especially if you leave dirty diapers on the counter. Then you can put your child's supplies away back where they go, which is just right underneath. And then from there, you will wash your hands. Before you wash your hands, you should make sure you throw away all of the dirty items into a covered trash can, and then go wash your hands. Clean. Items put away. So then after you're completely through with the diaper change, you then move on to the documentation side of it, where you will get the classroom's tablet and go to the Brightwheel app, where we document the diapers, document if we had to put cream on the kiddo, we communicate with the parents if they're needing more diapers, wipes, etc. So you will go to Brightwheel, which is this little icon right here. Click on that, and you should pull up your kiddos' names. Click the child you just changed the diaper on, add activity, and do the potty icon, which has a little blue circle and a toilet. So with this, it gives you options of diaper, potty, or accident. And then so for this instance, it would be diaper, what it was, so wet, bowel movement, or dry. It is very important to document, even if you check the kiddo and they had a dry diaper. It's super important that you document it, not just for the fact that parents need to know if they're having multiple dry diapers in a day, as well as it does show that you have paid attention to the child and that they are getting checked daily. Because if you leave it blank, parents will think that you aren't checking their diapers. So we want to make sure that we do communicate diapers are being checked, they're just dry. So for this instance, we had a child who had a wet diaper and a bowel movement, and we did need to apply cream. So in this part where it says note, you will do applied ointment. Again, this just shows parents that we have applied the ointment. So if they get home and see that they're a little red, we have been applying ointment. So it could be something they ate. It could be something, maybe they're on a medication that irritates them after they have bowel movement and just makes it more acidic-y. So then you will add the activity, and it will show up on the parent's feed for them to see, so they can go through their whole day and see what their diapers were like. And if they're having to have ointment applied often, they could be getting a rash or something like that. This is also the app we will use to communicate to parents if they need more diapers or wipes. So you will go back to this screen for your classroom and do messages and message to the parent, more diapers, needs more wipes, needs more ointment. We like to give them at least a 2 to 3 day notice before they need to have them here, before they run out. I think that's important for parents who just have busy lives. And so we want to give them as much time as possible, instead of just when they come and pick up, hey, we need diapers tomorrow. They've been out for days. Parents don't love that. So if we can make their lives as stress-free as possible, we want to do that. So that is all the Brightwheel documentation. When applying a diaper rash cream, every classroom has a medication book that keeps all of the kiddos' forms signed by parents allowing us to apply diaper rash cream, sunscreens, things like that. In the classrooms, these books really just contain the lotions or ointments or things like that, the topical things that are put on the child. All of the medications that a child were to ingest, such as Tylenols, pain relievers, prescription medications, things like that, those are all housed at the front office. We have them in a locked closet and keep all that documentation up there. It's just one less thing that classrooms have to worry about. But with diaper rash cream, sunscreens, things like that, that all stays in the classroom in a locked cabinet. So you will go to the child's name. It is labeled. It has their own little dividers, as you can see. And it has each child's name on it. So you will go to the child's name that you changed the diaper and applied ointment for, and pull out their medications, and you will. A parent needs to make sure they have filled out and signed in date, proving that they are allowing us to do diaper rash cream on their child. So you will write today's date, the time of which you applied the ointment, and your initials. We use Bright Wheel as well to document that. However, this is the state's guidance on, or policy on documenting medications. So we need to make sure those are initialed every time we put the ointment, sunscreen, whatever it may be on. Again, further documentation showing you have done your job. If a parent has not signed off on a medication form for a diaper rash cream and you notice a kiddo's really red and could really benefit from having a diaper rash cream, we ask that you send a message on Bright Wheel, allow about 30 minutes to go by. If we haven't heard back from the parent, we ask that you text the front desk, or if you're able to stay in ratio and come up to the front desk and explain to us the situation, you do so, and we can give the parent a call and ask for verbal permission for the first time use of a diaper rash cream. When they then come in, we want them to fill out that form approving that we have diaper rash cream. If they give that verbal permission to do so, we will just use a daycare cream that just kind of a generic A&D ointment, Desitin, something like that. We just don't want kiddos to go all day without anything on, especially if they have a rash. With that, like I said, parents need to come in and fill out that form that when they pick up for the day, because we want to make sure they have approved us to do it later and not run into that issue again. We also will ask that they bring diaper rash cream to have here. There's some kiddos who just don't get diaper rashes that often, so parents don't even think about it, but there's sometimes where maybe they just eat too much fruit, or they're on a medication, or some kind of fluke thing that can cause diaper rashes that maybe never did before. So we like to tell parents to go ahead and bring it just in case they ever need it, but in the off chance that they don't.